In the name of God, most gracious, most merciful, we would like to welcome our speakers to the press conference of the National Taskforce for Combating Coronavirus COVID-19, His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, member of the National Task Force for Combating Coronavirus COVID-19, Lieutenant Colonel Dr. Ahmed Al-Ansari, Director of Training at the Supreme Council of Health, Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now we begin with His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, thank you for the Lord who knows everything, and praise be to the Prophet and his family and companions. We would like to welcome you again in this press conference to inform you of the recent updates in the Kingdom of Bahrain regarding dealing with COVID-19. We highly appreciate the appreciation of His Majesty King Hamad bin Isa Al Khalifa for the health professionals while heading the Supreme Council of Health, and we ensure you, Your Majesty, that we're going to be ready every time. The Kingdom of Bahrain has been ready in each individual in this kingdom to be ready to deal with this COVID-19, and today we continue with determination with the loyal people of Bahrain with all the efforts to deal with this virus. The continuation of the international recognition shows and proves the right way the Kingdom of Bahrain is taking, with the praise of the Dr. Tedros, head of the World Health Organization, that makes the Kingdom of Bahrain really continue with determination. And let's talk about the capacity of the centers in the Kingdom of Bahrain. As for the treatment and isolation, stands at 8,357, of which 2,839 are occupied. So thank God, we still have capacity. As for the active cases that have self-isolation, stands at 1,814, and they do not suffer or experience any symptoms. That's why, thank God, these numbers are those who are at home. They have certain conditions for testing so that they can decide whether they have self or not self-isolation. As for the recovered, they are 83% of the total number, and this is a great percentage for recovery, while the death percentage 0.32 of the active cases. And we have seen over the last couple of days, we're not. The more you have active cases, the more you have the death cases will lead that. And hopefully we pray God that things would go better. To conclude, we confirm that the national intention requires us to be all following the required precautionary measures. Now I'll leave you with Dr. Manaf Al-Qahtani. In the name of God, most gracious, most merciful, today Today I'm going to talk about two important pillars: the objective of the visit of the Italian representatives to the Kingdom of Bahrain. We have taken great efforts. We have taken through different stages: the preparation, the medical. Now we're going into the continuous determination to deal with COVID-19. As mentioned by Dr. Walid Al-Mana, we have really taken unprecedented steps and scientifically proven actions based on national and international research. Thank God, we've been praised by regional and international organizations to combat this virus, and we have to double our efforts in the coming period of time to contain this virus, and so we can go back to our life. So the first pillar, we would like to announce the arrival of the Italian representatives delegation, and the head of the Supreme Council of Health received the delegation from Italy to exchange expertise on how to deal with this virus. Among the most important objectives is to share the international experiences and share information, and to provide the Italian delegation with all the treatment protocols used and implemented in the Kingdom of Bahrain. And we have plenty of time to discuss many things. The main objective is to enhance the track of work and provide it with the best methods. The second pillar, as for the precautionary measures taken by the BDF hospital to combat this virus and provide the best health services for the patients. The BDF, an implementation of the decisions of the BDF to provide mobile isolation units for those suspected cases before arrival of to the hospital. These mobile units, first these cases are categorized, and then they can use them as rooms isolated. They are equipped with the best health equipment. The main objective is that the virus will not be transmitted to other patients in the hospital, and also to protect the health cadre. One of the advantages is that there is totally isolation. If the patient is with the virus, you can control the room and prevent it from being transmitted outside the room. And so we emphasize on the effectiveness of these rooms. At the same time, the space of these rooms is good, 3 times 3 meters, and it can be renewed and changed, and that's why it can protect the people within. There is also an intensive care unit provided with the best equipment, just God forbidden if they had to use them. The second action is also using there is a special unit that would prevent the virus from going outside the hospital. So all these actions are aiming at protecting the health of the patients as well as the professional team. So to conclude, please, we have to follow these health guidelines, and we shall continue with determination. And I would like to leave the floor to my colleague, Lieutenant Colonel Dr. Ahmed Al-Ansari. Peace be upon you. Good afternoon to everyone. I'm very pleased to be with you in this press conference session, and I'd like to confirm that everyone shall continue to maintain the health and safety of themselves and the others. And I'd like to express my sincere thanks and appreciation to the medical staff for their continuous efforts to protect the health of the citizens and residents and to strengthen the health system. And we thank the citizens and residents for following these guidelines and to implement the best practices which will have a great impact on our life. Now, allow me to talk about the indicators related to the spread of the virus. The first indicator is the duration taken to double this virus. The recent information said the cases in the Kingdom of Bahrain have been doubled, but then later there were no doubling of the numbers over the recent days. There were 12 days before. And up to date, there is no doubling of the days. As for the residents, the days are at a range of 21 days, and there is no increase in the numbers up to date. This shows the commitment of the citizens and residents to the health guidelines, and we wish that they would continue with great determination. As for the percentage of the active cases compared to the recovered cases, these could be 1 to 1. They were from the 22nd of June to 5th of July, they were 0.5 to 1.4. 0.6 means if you have 100 active cases, then there will be 6 recovered. And compared to the previous percentage from the 1st of July to 14th of from the 1st of June to 14th of June, that is a better percentage. The third indicator is the total cases, active cases, which are new out of the total tests. The test, the positive, should not be more than 5% out of the daily tests. The number shows over the past 2 weeks, the positive cases in the Kingdom of Bahrain from 4.3 to 10%, while the previous percentage from the 1st of June to 14th of June were 4.7 to 9%. Now we move to the the R naught or RT. Over the past 2 weeks, the RT from 1.1 to 1.4, that shows there is a decrease in the number of the active cases, which were from 1.3 to 1.8. But everyone should do their best to reach the safe figures, and so we can all overcome this challenge successfully. We cannot unless we fully follow the guidelines and instructions. To conclude, I'd like to remind everyone to keep in mind social distancing and to keep a distance not less than 2 meters, and wear face masks, and also to follow all the decisions and guidelines issued by the authorities concerned in the Kingdom of Bahrain, so we can get to the best. We confirm that continuing with determination would reflect on the success of all the efforts nationally, and hopefully we're going to achieve our goals. Now I'll leave the floor to Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. Thank you very much, Dr. Ahmed. Peace be upon you. At the beginning, I'd like to confirm that the health and safety of everyone is great priority at the Kingdom of Bahrain, and we shall all continue with determination so we can overcome this challenge and hopefully to combat this virus. Well, among the precautionary measures is to increase the total tests conducted. Up to date, it is over 600,000 tests. This is among the total, the highest numbers of tests in around the world, and as mentioned by Dr. Ahmed, is among the indicators we count on in order to lift or keep the guidelines and actions. So we conduct more tests so we can reach the active cases. So when we follow the testing, treatment, and tracing. So if we get the active cases at an early stage, it would be better for us where we can provide them with the best treatment, better than if we reach them at a later stage. And that contributes to the best recovery numbers. As for the current status of cases, the active cases critical are 60 active cases, and which requires treatment are 58, and they are followed by 24-hour specialized medical team follow-up. And we have the stable cases are 4,593, which do not need treatment, and we're trying to avoid any complications. As for the recovered, we have 25,570. They are out the isolation and treatment centers, and these are among the new indicators that we count on as well. So if we have to need any of these centers in the future. So all these figures, they require everyone to follow the precautionary measures, wearing face masks, and this should be whether gathering with people at work, at home, or unless if you are exercising certain kind of sports which requires great efforts. And we continue with recommending and advising people to washing hands and keep a distance of not less than 2 meters. And the last point, if anyone has experiencing any symptoms, please call 444 so you can have a test and you can get the best advice on how to go to the health center and take the necessary action. And we call upon everyone to follow in order to reach the best level of health, that they follow these guidelines and instructions, and hopefully over the coming weeks we would have less active cases. Thank you very much. Thank you, the speakers. Now we'll have the question and answer section from the reporters and journalists who are watching us remotely, following us remotely. Question from Ayman Shakal from Al Watan to Dr. Walid Al-Malik. Right now, many places are open which used to be closed, including the Bahrain International Airport, with the increase in the number of deaths. So why not waiting until containing this virus? Thank you for the question. First, as for closing the airport, well, Bahrain International Airport, within the past period, it was not closed. There were certain precautionary measures with certain conditions for passengers so they can use the airport or not. These conditions, in fact, are positive. So now it is within the same conditions and within the question is the increase of the death cases. Dr. Ahmed talked today about the indicators, the progress of this virus. So we're not talking about figures. The death cases are not the only indicators. There are other ones. And also the capacity, including the capacity of the country. So it's not only about an increase in a figure or not. And just to let you know, the airport is not closed, but there are certain conditions and measures. So we confirm that there are more than one indicator to measure the situation. Yara Nasser from Akhbar al-Yom to Dr. Walid. With the near time of opening this King Fahd Causeway, well, the relationship between the two friendly countries, Kingdom of Bahrain, Kingdom of Saudi Arabia, is deeply rooted country relationship. So there are plans, precautionary plans, and continuous coordination between the two countries for any decisions taken. As for the causeway, definitely there will be certain precautions and there will be coordination for the people getting over the causeway. And there are also certain indicators, most importantly, to protect the health of the citizens and residents of the Kingdom of Bahrain, and also for the GCC countries. It is important for them, even for this Kingdom of Saudi Arabia. So are there any plans? Yes, we have plans and readiness is there and always continuous coordination to protect the health of everyone. And whether it is open or closed, there will always be coordination and continuous coordination. Naila Barakat from 24/7 News. What are the latest updates on the treatment? Well, the treatment protocol of plasma has been implemented. As for this study, this week is the last phase. We have an international delegation, and we need a neutral party organization so that can decide. From Bana, question from Bana to Al-Ansari, Dr. Ahmed Al-Ansari. What is the time needed so that the number of the active cases will increase? Should be, the sound is not clear, so it is less than 14 days. Question to Dr. Jamila Salman from Star Vision. There are side effects after the recovery. Can you brief us on any cases or the side effects? Thank you very much. As for the effects of COVID-19, what is different, whether it is similar to influenza? According to the studies, all the recovered, you would see them that are like long-term symptoms. 40% of the study, it could affect on the patient. First, they start with the lungs because it is where the inflammation starts. And they have sort of change or like inflammation in the lung. And some of the patients might have longer use of oxygen even after the recovery. The second part or organ of would be the heart. The patients, if they have problems with their heart, that could have some effects even if they are recovered. The third organ would be the neuro system. They might have brain effects, and also that might have an effect on their concentration, and we've noticed some of these in Bahrain and also around the world. And we have changed the treatment protocol. We have seen it is not about the side effects. There is great part is related. They might have something related to the heart problems, and some might have certain conditions like lack of sleep, like the lack of smell, and it might go back over time. And now we're looking forward to the receiving more experience from the world. Question to Dr. Manaf. Tamam Busafi from Al-Ayyam. You announced recently to change the options of the 444 call center according to the need. But unfortunately, nobody's answering. Like even people have to wait, and they have to call 999 to. So what about the booking the chance to book for the test. There are different perspectives of this question. For the Trouble 9 is really like for the urgent cases. Since the establishment of the 444 up to now, they've received more than 600,000. Just over the last week, over 180,000 calls. So there are general inquiries, and people can receive information from the Ministry of Health website, and people might call to get their results of their tests. So there are different factors that would make the team of the 444 under huge pressure, and it is not just a small percentage of calls. The duration for the person to get the sufficient call would be 4 minutes. So there is a huge pressure. However, the VR automatic response would show the importance of the call. If you need quick response, they can press that. According to our statistics, the duration for the urgent cases, they are less than 20 seconds. So the importance of the call would be, if someone calls, just presses the AVR, the automatic response, then that would be not urgent. Also, to confirm, there is a meeting for the team Trouble 4 to increase the capacity of this team and to update the system internally so that the request will be transferred automatically to the other competent authorities. Most importantly, to deliver the service to the competent authority. And that's why it might take time. But with the awareness of the people on how to use this hotline, and with the transfer of the cases to the competent authorities, it would be better. From VT to Jamila, Dr. Jamila, are there any cases which have got the virus again? And are they considered new cases after the recovery? Thank you for the question. The simple answer, we don't have any case which have reinfected cases. I'm not saying the Kingdom of Bahrain level, but around the world, we don't have any scientific proof to that, because some countries, they said some cases might have the virus again, but with the current studies and following up with the active cases and the recovered people, even if you do the test, it could be in the swab for 1 month to 2 months, but it is not going to be contagious. Some studies are talking about the relationship of the virus with the immune system, and that has led to many studies to the antibodies within our bodies. So the body would create antibodies. The same thing with COVID-19. The studies showed that patients would have antibodies, might continue, some antibodies might not continue, but it's not going to come back reinfected. We don't have any scientific proofs. Another question to Dr. Jamila from Al Bilad newspaper. The World Health Organization of a piece of news that the virus can be transmitted through the air with particles. Are there any precautionary measures to be taken? Were they enough? It is a very important question. For this virus that it is under discussion for so many time, can it be transmitted over the air? The difference, there are two transmissions. You need to be maybe 1 meter to 2. So these particles would be, it could go on the surface and might be transmitted over the touch of hands. But over the transmission of air, it is very, very rare. So the latest information talked about by American researchers recently, some scientific evidence that it could go over the air. But is it going to change our method? Well, in all our hospitals, in all our isolation treatment centers, we adopted that there is a possibility of this virus to be transmitted over the air. That's why we ask people to wear face masks. As for the public places, wearing a face mask is very important. And that's why we also keep in mind the social distancing. And those would help. And in the Kingdom of Bahrain, our precautionary measures are very effective. We're not seeing any increase in the problems. Question to Dr. Walid Al-Mana from Al-Usra. After reopening of the airport, is it going to have necessary for a PCR certificate? Is it required? Well, thank you for the question. As for the certificate, it requires certain technical and logistic requirements, and to certify it and to maintain its credibility from not to be frauded. And this is under study to make sure that these technical and logistic requirements, before issuing it and before adopting it in the Kingdom of Bahrain, whether the tests are conducted in the Kingdom of Bahrain or outside. So it is really important, but it is under study and reconsideration. We need more information so we can accept these tests. The last question, Hamad al-Nahas, Al-Usra Al-Arabiya. Some patients with chronic diseases, they need continuous follow-up. They are scared from going to hospitals, fearing that they might have the virus transmitted to them. Is that correct? Is that right or wrong? Whenever there is a pandemic, if anyone with chronic diseases, they have to continue their appointments, because the percentage of is less in the hospital, because all the hospitals in the Kingdom of Bahrain have taken all the measures, whether from the transmission from a staff to a patient or a patient to a staff. All the hospitals are ready to decrease the number of these transmissions. So hospitals, they should really take care of the people with chronic diseases, and they should not leave their appointments or medications. So I hope everyone to continue their treatment and to follow their appointments, and all the measures. Well, now we conclude the question and answer section. Thank you very much, the speakers, for your briefs and for answering the questions. We also thank the journalists and reporters, and you, ladies and gentlemen. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19. Thank you all.